Hear from Professor Vernon OBE, who is a founder of the Magonzi Fund and also co-editor of Black Grief and Healing, but also one of the handful of Integrated Care Board chairs. So, Professor Patrick, over to you.
I'm tall. It's really great to be in this great city of Manchester. I've got many fond memories of being a student in Manchester back in the day. If you know the Nile and Reno, then you understand. This is really important that we're here today because as we acknowledge 5 years since the pandemic, I want to acknowledge all the partners that have organised today's event, the Cathedral, Khan, Rafa, Churches Together, and Marie Curie. And actually Marie Curie had the idea 5 years ago for a National Day of Reflection, recognising the amount of people that died in a short space of time, and definitely in the black community. We don't know the true numbers, to be quite honest, but it's going to be in the tens of thousands of people, black people, African and Caribbean people who died during that period. And if you could cast your mind back 5 years ago, we've heard some fantastic testimonies of people's experiences who have experienced COVID. But just imagine what happened 5 years ago when we weren't allowed to communicate, to work, travel, etc. All of us experience social isolation. We all experience anxiety, depression, but more importantly, we lost loved ones. I am sure that all of us in this cathedral can share testimonies of how they lost loved ones. In my family, I've got 4 sisters, and one of my sisters lost a long-term partner, Alex, died in Derby in hospital of COVID. And we couldn't even go to Derby to see her, to show love for her. We had to do it online. We couldn't even go to the funeral or anything of that nature, basically. But this replicated itself for all the families up and down the country, particularly for black families in particular. We know that when we say goodbye to our loved ones, we have a process called 9 nights. We have a way of how the community comes together to say goodbye to our loved ones. But because of restrictions, we were not allowed to do that. We weren't allowed to say goodbye in a way that we know how to say goodbye in our cultural, religious traditions. And this had a double impact on lots of people. That if you couldn't say goodbye to your loved ones, because once people went into hospital, that was the last time you saw them. And so one of the things, as I was reflecting in my experience of losing a close family member and hearing stories of other colleagues and people, what could we do as a community? And I have to say that particularly the faith community, more so than the government, I have to say, rose to the challenge. Would you agree with me? We rose to the challenge of compassion, kindness, but yet the government didn't acknowledge black grief at all. If you can remember, there was a certain gentleman called Matt Hancock, who was Secretary of State for Health, and he was interviewed numerous times. You know, they had the West Wing, the equivalent of that, at number 10. And he was asked numerous times, raised issues about discrimination, the impact of COVID on black and racialized communities. And he kept on saying all the time that COVID does not discriminate. But it did discriminate. It reinforced the structural racism and impact of black lives in British society. And to further complicate matters, we weren't even given the permission to grieve and say goodbye to our loved ones. So I was involved, I set up the Magonzi Fund with the help of Yubele, and basically to raise money, so when the pandemic was over, people could have the opportunity to say goodbye to their loved ones. We raised about £100,000 from different causes. London Gospel Community Choir, for example, gave royalties for one of their songs. People made T-shirts. People did online yoga classes. We raised money, and then we had 2 rounds of grants where we gave money to communities, black and racialized communities up and down the country, to plant trees, to have park benches, to commission artists, to celebrate people's lives, and people were commissioned music as well. Through this process, we came across so many stories of grief from the community, because prior to the pandemic, when someone died, you acknowledge that, and that was it. But this happened exponentially in terms of the impact of the pandemic within black communities. In certain parts of the country, and where I grew up in the Midlands, particularly in the Wolverhampton, Birmingham area, a whole generation of Windrush people died during that period, most often in churches. Going to the church, and actually whole people died during that period. So we had loads of stories of reflections, and my colleague Yancy Ralston, we decided to do this book. It's called Black Grief and Healing. And it's not purely about COVID, because COVID actually forced us to start looking at issues around experience and grief. I had the privilege of working Macmillan and Marie Curie. They had had a commission on grief and bereavement, which was chaired by Bishop Sally Davis, from Bishop of London. And we came with a whole set of recommendations, which I hope the current government will implement, on recognising properly that grief has impact on everyone, but particularly it has a disproportionate impact on black communities as well. And so one of the key things around grief and loss is, how do we celebrate that? How do we acknowledge that? Today's event is part of that process. And for the last few years, there have been similar events in Birmingham recognising this, and all around the country as well. There's people now recognise that we have to talk about grief, loss and dying, and end-of-life care. This is really important because, as Charles alluded to, I chair a Birmingham Solihull Integrated Care Board, one of the biggest health systems in the country. And we still have we're still recovering from the pandemic. Our hospitals, primary care, how we work closely with local authorities and communities. We still got a lot of work to build trust and confidence in people accessing healthcare, accessing the vaccine, but more importantly, our frontline staff. And remember, a lot of black frontline staff died without that proper recognition support. So the book itself is about black grief and healing, but it's recognising that this is not the first time that a lot of black people have died in this way, and it shouldn't be the last, and it shouldn't happen again. We need to be prepared. We have resilience in our community, but more importantly, we need to work together in a way that we've never done before, to ensure that we have information at our fingertips, that we support each other, and the role of community and faith organisations play an even more important role in how they play a part in working with the NHS, local government, other parts of public services as well. Because even though, there could be another pandemic, but we've got many pandemics. We've got current viruses, which is having a major impact on the NHS services as we speak. So the day of reflection is something to recognise our loved ones that have passed on, but recognising that we are survivors, all of us. We survived the pandemic, didn't we? So we survived, which means that we have to do something with our lives, with our influences and our connections, to make sure that either it doesn't happen again, or we're more prepared than ever before as well. So I just want to thank everyone who's been here today, and let's continue that reflection and acknowledgement of those who've passed on, and for us as being survivors, that we can continue and make a difference in the society. Thank you.